We primarily see patients with OSA, which is obstructive sleep apnea. These are patients that wake up frequently during the night, choke. Some of them complain of choking, just poor sleeping habits. So we bring these patients in and we hook them up with a series of electrodes, head electrodes, snoring mic, we like to see if they're snoring or not, chest electrodes to see how their breathing is. We also look at their oxygen saturation to see if they drop with their oxygen during night. We look at their rhythm strips of their heart, and we're monitoring all these things during the night. The techs are watching them via video camera, and based on what the results are, we decide whether they have obstructive sleep apnea or they have something else, or they're breathing. We get a referral from a physician, where they make an appointment for the sleep lab. Then they come in and they spend the night. We've set up each patient's room to look like their bedrooms at home, as close to that as possible. We have them lights out at 10 o'clock, and we hook up the series of electrodes, head electrodes, chest, leg, limbs, and we're looking at oxygen saturation. And we're looking to see whether they have any of those sleep behaviors. The most common that we see is OSA, which is obstructive sleep apnea. And those are folks that complain of choking in the middle of the night, waking up and feel like they haven't rested at all, because they really haven't. They've tossed and turned all night. So that's the majority of the patients that we see. Some of the symptoms of obstructive sleep apnea would be feeling tired all the time, waking up feeling like they haven't slept at all, wake up with headaches, sour taste in their mouth, falling asleep at a chair, like you and I are talking right now. They would fall asleep. Fall asleep while driving. There's a lot of different symptoms like that. Leg jerks is another one, sleeping in the restless legs. So there's some of the common ones. The patient doesn't come to the sleep lab and get diagnosed, and I'm going to go with obstructive sleep apnea because that's the most that we see most of. When they have continually sleep like that with low oxygen saturation levels and everything, it becomes a strain on their heart. You don't get a good night's sleep, your heart doesn't work right, oxygen level drops, and you'll continue to have those symptoms, like I just said, with the headaches, the sour taste in your mouth. If we find in that first 4 hours, or sooner, that you've had a lot of what we call apneas, period of not breathing, we'll go ahead and start you on what we call CPAP, with continuous positive airway pressure. We set you up with a mask. The tech will come in and fit you, and we'll start you at that point. Most of our patients, we don't get enough clear data till later on in the study, and after the physician interprets the study, we'll find out whether they had obstructive sleep apnea or the test was normal. If the test was positive for OSA, we'll have that patient come back as soon as possible for a CPAP titration.
Okay, and what's that?
That's when we put a mask on over their face or over their nose, or we use nasal pillows. And it keeps, with the air flowing in, keeps their airway open, so they don't have that choking or gasping for air at night. It allows the patient to get plenty of air, keeps the airway open, and they sleep well. It's best to call the hospital, South County Hospital, and call the scheduling department. And if they have an order from their physician, and schedule a sleep study. If they don't, and they just want to speak to one of the techs during the day, which she's there 5 days a week, they can call in during the day and ask, and we can also possibly help getting that referral. We have 2 pulmonologists, board-certified sleep physicians who read the sleep studies. I think the difference is, first, is we have all registered sleep techs. We have 2 board certified pulmonologists and sleep physicians, board certified. And I think we have high quality staff who are very caring. I think any patient that comes to our lab feels like they get treated extremely well. We've designed the rooms, like I said before, to look as much like home as possible. We've furnished them with not hospital furniture, but regular bedroom furniture. And we try to make the patient as pleasant as possible, make their stay pleasant.